Tonight's webinar will be presented by Dr. Brad Holland, a board-certified prosthetic urologist and men's health specialist. Dr. Holland, thank you so much for your willingness to be here with us this evening to share this important education and your expertise with the Quincy community. I'll go ahead and turn it over to you to get us started.
Excellent. Thank you very much, Shauna. Thank you all for coming and joining us tonight and learning more about erectile dysfunction and men's health and different options we may have for it. Here you can kind of see our contact information and our number below if anybody needs to call and make an appointment. And we always tell people after you call that number to hit option 4, and it can kind of speed you up to get into our office and get an appointment. A little about me. I was born and raised in Central Illinois, went to med school and residency over in Springfield, so not far from here, and knew I wanted to practice in an area, a smaller town area like Quincy, and it was an easy fit for me. A big part of my training was in general urology, but I always had a special interest in men's health and specifically erectile dysfunction. And a large part of my training was specifically in prosthetics. And so that's a big part of what we'll go over today. First, I want to talk about just erectile dysfunction in general and learning some things about it. One of the biggest things we know is that erectile dysfunction is much more common than guys like to talk about. And it's a hard thing for some guys to talk about, but when we come down to really what is it, we consider it the persistent inability to achieve or maintain a satisfactory erection to have a sexual intercourse. And it's very common. Over age 20, 1 in 5 men have erectile dysfunction. And once you get over 40, half of all men have erectile dysfunction. So it's much more common than anybody thinks. And there's a lot of men that are either actively seeking treatment or interested in seeking treatment and maybe have trouble trying to figure out where to go. The erection process is a very dynamic situation. So it involves both the nerves of the penis along with the blood flow of the penis. And we're going to really get more into that. But what it requires is the nerves have to be activated, and that allows all the muscles to relax and blood flow to increase into the penis. That's what gives you the erection and the firmness of the penis. But then it has to compress the veins to prevent the outflow of that blood. So you can see there's nerves involved, there's muscles involved, and there's blood vessels involved, and multiple different things. And really any disruptions in those can cause issues with erectile dysfunction. So when it comes to the causes of erectile dysfunction, it's not just one thing. It's many different things, because any disruption in any of those issues can lead to not being able to get that satisfactory erection or maintaining it. The big risk factors you can see there: age, smoking, blood sugar and diabetes issues, high blood pressure or hypertension, and dyslipidemia, which is cholesterol and fat levels within the blood. There's also a lot of other issues like depression and anxiety that can cause it, sedentary lifestyle, and obesity. You can kind of see some of the breakdown there. And a big thing about it is that not only is erectile dysfunction caused by a lot of things, but the presence of erectile dysfunction can cause a lot of issues too. And one of the big ones is the psychological effects that can have on men. We were saying earlier, it's hard for guys to talk about it, and it's hard for anybody to talk about it. So then they end up bottling that up, and that causes them to have issues with anxiety and depression and confidence issues. And that leads to a lower quality of life. It leads to issues with their partner. And it really can, a lot of guys can struggle with it, and it can really hurt them in a lot of ways. And if they don't know where to go, it really kind of compounds on itself. So, and I think something that really showed how kind of monumental treating erectile dysfunction can be is that with a lot of these treatment options, I mean, we've had studies that show in almost 200 patients that 95% of them got a satisfactory result with an implant. And even crazier, 97% of them recommended it to their friends or would recommend it to their friends. So I really think this kind of shows how it's an incredibly common situation. It's caused by a lot of different issues. But as you can see here, there's very effective treatment options. And one of the big things is just getting in to talk about it and see what those options are and see what options might help you. We want to go a little farther in depth in some of the different causes of erection and some of the relationships they may have. So one of the big ones is diabetes, a very common situation. And about half of men with diabetes have sexual troubles that are thought to be caused or worsened by their diabetes. And even more so on top of that, people with diabetes and erectile dysfunction generally have harder to treat erectile dysfunction. And the medications don't seem to work as well, or they don't seem to last as well. We've even seen in a lot of ways, guys can come in who haven't really seen a doctor in a long time and start getting treated for erectile dysfunction, and that can be their only symptom of diabetes. And we'll talk about that more when we get to the heart disease, but erectile dysfunction itself can actually be a sign of other things going on, and that's one of the big reasons to get it treated. So how does diabetes affect erections? It affects both the nerves and the blood vessels of the penis, and both of those are very important to erections. As you age, those blood vessels get a little weaker, but then the damage from the high blood sugars directly damages the nerves, damages the blood vessels, and allows them not to be able to expand to what they need to do. Now, with both of those issues, it's harder to get an erection, but then also the pills for erections, Viagra, Cialis, I'm sure you've all heard many different kinds, those require the blood vessels and the nerves to be intact. So if either of those are damaged, especially severely damaged, then the pills aren't going to work nearly as well. A big one is heart disease. And this we did a lot of research in residency specifically of, in the relation between erectile dysfunction and heart disease is very apparent. And in fact, heart disease and erectile dysfunction can both kind of predate each other. So people with heart disease usually develop ED quickly after, but then also a lot of people with erectile dysfunction then develop heart disease later. And the severity of either one is related to each other. So men with worse erectile dysfunction are at a higher risk of worse heart disease. Men with worse heart disease are at a higher risk of worse erectile dysfunction. And erectile dysfunction itself is a higher risk factor for future heart-related events, such as heart attacks and strokes and other issues. The erectile dysfunction actually precedes coronary artery disease, which is a main risk factor in a heart attack by almost 70% of cases. And why that is shown here excellent, where the penile artery, the one farthest on the left, is actually smaller than the blood vessels that are going to the heart. So if there's some kind of process that's causing damage to the blood vessels of the heart, it's also going to be doing that to the blood vessels of the penis and vice versa. So if those penile vessels are damaged in some way, then that it can be a marker of possible future injury to the blood vessels going to the heart. And so when getting guys in to treat their erectile dysfunction, a lot of times we can find that they may be at an increased risk of heart disease, and making sure that they're set up with a primary care. Or I've had guys that we send directly over to a cardiology office from our office that are being treated for erectile dysfunction, because it's more than just your erectile health. The sexual health can be a marker of a lot of other underlying factors that we need to take care of or need to get worked up. One other big one that's talked about a lot is low testosterone. And low testosterone is an interesting one, where this develops from your body just not being able to produce enough testosterone. And it happens more in people you see there that are older, have obesity and sedentary lifestyle, poorly controlled diabetes, and then some chronic conditions. Very similar list to those people who have erectile dysfunction. And these seem to coincide together. And a lot of men with low testosterone can develop erectile dysfunction issues. A lot of guys with erectile dysfunction will also have testosterone issues. And it can be a tough thing where treating the testosterone doesn't necessarily improve the erection, and usually doesn't, but it can help with libido and other parts of sexual dysfunction. And there are multiple different treatment options available, whether it's injections or gels, or even there's some oral medications now. And so I hear we have a testosterone clinic to help also with the testosterone side while we're treating your erectile dysfunction. A big one that's near and dear to urologists is the erectile dysfunction that can develop after prostate cancer treatment. And this is a big cause of men that can have some treatment regret after the prostate cancer. They can be doing great from a cancer standpoint. They can be well controlled, they can recovered well, but now they're trying to get back to what those levels they were at and trying to get back to their life, which includes their sexual function. And we've seen even with our great advances in some of these nerve sparing procedures, a lot of guys still may never get to their previous level of erectile function. And some of those blood vessels and those nerves that control the erectile function run right next to the prostate. So whether it's being removed when the prostate's being removed and that section is being connected back together, or when they're getting radiation to that area, it's common for those nerves to get damaged. When those nerves get damaged, they can take a very long time to fully recover. It can take a year or more after surgery. And a lot of guys still have persistent issues with erection. Now that can be quite variable. Some guys can maybe get erections but not maintain them. Some guys can't get erections at all. It's quite a spectrum. But we don't want guys to be living in any kind of treatment regret and have loss of their quality of life because now they've been treated well for their prostate cancer. We really want to get them as rounded as possible. And now we've helped their quantity of life. Now we want to help their quality of life. And treating that erectile dysfunction is a huge part of that. Another thing that I feel is becoming more and more talked about there's some commercials. You'll see the peppers and the carrots on TV, but is Peyronie's disease. And this is curvature with erections. Peyronie's disease is a very specific type of condition where there can be buildup of scar tissue forming a plaque within the penis. And it's specifically within the portion of the penis that gets firm with an erection. Now, when one part of that has some scarring, it can cause curvature of the penis, sometimes pain with erections, and can a lot of times prevent intercourse. But the other thing that's doing by having that scar there, it's limiting some of the blood flow coming in. When you limit that blood flow, it obviously causes issues obtaining or maintaining a good erection. So they really kind of go hand in hand. It has nothing to do with any kind of cancer. It is purely a benign condition that is unfortunately, think of it as the body forming inaccurate scar tissue in response to some kind of stimulus. So there are a lot of treatment options for that. There's some things that kind of help with the scar tissue and break that down. And some of those can help a little bit with the curvature. Unfortunately, the other issue is that you might be able to fix some of that curvature, but then you still have the issue with erections from the blood vessels being damaged. And that's why we actually see one of the best treatments for that is also a penile implant, because the device itself can correct that angulation that the plaque was causing and also treat the erectile issues. So a lot of times we end up doing these implants for Peyronie's disease and for erectile dysfunction, and really gives guys a great outcome from it. I want to get more into some of the treatment options for erectile dysfunction. And there are multiple options, and determining which one is the best one is big. Now, part of this is guys knowing where to start this process. And who do you go to when you want to start being worked up for erectile dysfunction? A big part in that is your primary care. And like I mentioned earlier, when there's all these possible underlying conditions that we need to take into account whenever we see somebody for erectile dysfunction. And that's why one of the first things that when you come in for an erectile dysfunction consultation, we ask who your primary care is, because it's really important to get somebody in, to get you in with a primary care and have kind of that quarterback of your healthcare that can help kind of guide you through and make sure that there's none of those other conditions going on, that can keep an eye on your heart health, that can keep an eye on your blood sugars and things like that. There's a lot of urologists who treat erectile dysfunction and maybe have some of the other options that we'll talk about. And then there's more specialized urologists like myself who both offer those options, but then also offer the options of the implants. And that's one of the things that is a little more harder to find and not as common. And really getting the word out that the option is there is one of the big goals today. So what are those options? A big one is, of course, lifestyle changes in mental health support, and we'll go over that. And then beyond that, there's the option of oral medications. I'm sure everyone, there's all these commercials now for the Viagra and Cialis, and there's multiple different types of them. There are vacuum erection devices. There is injections directly into the penis to get an erection. And then there are implants. A big thing is these lifestyle changes in mental health support. And we really push these or recommend these no matter where you're at in terms of your erections. Even if your erections are just not as great as they used to be, to the point of having no erections. Getting a better lifestyle changes in terms of smoking and sedentary lifestyle, weight loss, things like that is incredibly important because of that risk with the heart disease. And also, we don't want further worsening of your erectile dysfunction, and changes in lifestyle has been shown to slow any possible further worsening. A lot of guys will actually even get regain of their sexual function by making some significant health changes. Quitting smoking, weight loss, and physical activity are the biggest of those. Erectile dysfunction has a huge psychological component to it. We mentioned earlier, there's increased rates of depression, anxiety, and loss of self-confidence. And just about every patient who comes in for erectile dysfunction, we offer them to meet with a therapist and talk about it. There's some people who that alone can be the cause of their erectile dysfunction. But then also, even as they're going through the treatment of it, talking to somebody is absolutely a benefit, and we highly encourage it. And it can be a great treatment option to treat with these other options to improve erections. Oral medications. These are the ones that I'm sure everybody's heard of them. There's a list a mile long of them. So how they work is they increase blood flow to the penis. That, combined with sexual stimulation, can help produce an erection or maintain an erection. They have been out for some time now. They do have some different kind of side effects, usually not too limiting, but usually the headache is probably the main one, sometimes some backache that can prevent guys from having it. Another big one is that there are some interactions with some different medications. So before taking these, and especially before any kind of the online distributors, I would highly recommend talking at least with your primary care, if not with a urologist, or come in and see myself before going down that road. Just because you'd hate to have any kind of interaction. It can be quite a serious interaction at times. And then, as we mentioned earlier, the medications, in some people eventually get to the point where they just don't stop working, and they're just not enough, or they're not getting an adequate result. And that's much more common in people with diabetes, likely because of that nerve damage. And we know people with diabetes, but really a lot of men with erectile dysfunction eventually need something more than the medications, or they want to move past the lack of the spontaneity with the medications. For you that don't know, generally you have to take these about an hour before intercourse, so it does require some timing, and that can be frustrating to some guys. There's a vacuum erection device. So this is a tube that goes over the penis, and then it creates a vacuum which pulls blood into the penis. And then there's a ring, if you see that red ring there, that you slide down around the base of the penis, and that's what holds the blood in there. And actually the next one we get to too are both kind of, in theory, they sound a lot better than they always work. And one of the big things is that it can be uncomfortable on guys. Some guys, it doesn't bother them at all. Not uncomfortable, gets a great erection, and they're happy with it. There are some time limits to use it. We don't recommend using it with any kind of drugs or alcohol because of the possibility of leaving it on too long. But the big thing is if that ring is comfortable or not. In a lot of guys, it ends up being pretty uncomfortable. Some guys have some amount of scarring within their corpora, within that tissue that expands to give them a good erection. And if you have some scarring there, you might not get a full erection. And it doesn't give you kind of what you're looking for, but some guys do. And so that's a big factor of it. Similar, as I was talking about, something that I think in theory sounds like it would be a fantastic treatment option, but unfortunately, just there are some issues with it. Is the injection therapy. So these are medications very similar actually to the medicines that are in the pills, but you can have a higher dose in an injection that you deliver directly into the side of the penis about 5 to 15 minutes before you need an erection. The needle is about the size of a diabetic needle, so it's very small. And some guys it does cause pain. Some guys tolerate it well. Um, our biggest concern or issue is that you have to start at a very low dose and you have to very slowly work your way up. And the reason for that is if you were to jump to too high of a dose, it can cause something called a priapism, which is a prolonged erection. Erection over 4 hours can actually cause permanent damage to the penis and worsening scarring, worsening of erectile dysfunction, and is a very serious condition. Their highest, the rate of priapism is highest with injections versus any other treatment option. And those guys on injections, we actually have made an entire kind of I guess you could call it a schedule, but how to do the injections and an entire handout directed towards that to try to make this as safe as possible. But even with that, even with guys who are getting good results with it, unfortunately, there's a high withdrawal rate, or I've also heard it called a dropout rate, which is guys who don't continue the injections beyond 1 year. And this is one of the things where how we were talking the difference between urologists and prosthetic urologists. A lot of urologists will offer penile injections to help with erectile dysfunction, and a lot of guys will get good results with it. But then we know either because of cost, because of the discomfort with it, because of maybe some priapism issues, or just simply because it kind of kills the mood if you have to do an injection right before having intercourse. A lot of guys stop using it, and this is where we kind of hit a wall with guys where they think there's nothing else out there. They don't understand that there's options beyond these injections, beyond pills, that could work for them, and not only work for them, but as we said earlier, have a really high satisfaction rate, really high recommendation rate. And really gives them a very natural appearance, and that's the penile implant, and that's something that prosthetic urologists like myself specialize in. So this is a device that's purely inside the skin. No one is able to see it. No one knows you have it unless you tell them that you have it. It when the device is deflated, it looks like a normal flaccid penis. When it's pumped up, it looks like an erect penis. There's two cylinders, and we'll kind of get into more of the specifics of it, but there's cylinder portions that are in the penis itself. There's a pump in the scrotum, and then there's a reservoir that holds the fluid that's kind of tucked in front of your bladder. There are some possible complications with it, and we'll really get into what those are. In this study we've talked about before, but it's really amazing. I mean, 97% of patients would recommend it to a friend. And we've seen that with, I've had a patient before who kept a version of the pump on his keychain because it was kind of a conversation starter, and he really wanted more guys to know about the option. So the penile implant here, it's the AMS 700 is what we use, and there's a couple different options for the cylinder, and that's really kind of more tailored to each individual person and kind of what they're looking for and what their options are. And it amazingly, it's coated in this antibiotic coating, which when this came out, I mean, it dropped the infection rate in half and really reduces the risk of infection, which is one of our, as you saw in the previous slide, is one of the big things that we really watch for. It's very natural appearing in terms of when it's flaccid, when it's pumped up, and it also gives a really good rigidity, and that helps with, I think, the satisfaction of intercourse, and also with guys for years maybe are dealing with not as great of erections, and then this gets them back to a good rigid erection that's effective with intercourse. And one of the biggest things that guys are always amazed about is that penile implants have been along far longer than than Viagra or Cialis have. And they've had great results well before those medications were available. And they are used much more commonly than I think anyone walking around would realize. So here's a great video just about kind of how the components work. Let's see here. So here you'll see there's a cylinder on each side of the penis there, and then a pump down in the scrotum. So when he pumps the pump portion in the scrotum, it takes fluid out of that reservoir that's at the top, kind of in front of the bladder there, and pushes it into the cylinders. And then when you hit the release valve, it takes the fluid out of the cylinders and puts it back into the reservoir. Now that reservoir is not able to be felt. It's hidden in an area that it's not going to stick out at all, and the pump really blends in quite well in the scrotum, and you'd have to know what you're looking for to try to find it. So, and that really goes a lot to the natural appearance of it. Let's never start there. Here we go. And here's another video of an actual patient having the implant, and you can see how naturally it appears. And so he has the AMS 700 that we've talked about, and he'll pump it up and deflate it here. There's some special ways to hold it that we go over, and there's a lot of kind of these follow-up aftercare things about the proper way to hold it and proper way of pumping it that gets you the best results. But here you can see stabilizing with his left hand, pumping with his right hand. And as he pumps it up, he gets a firmer and firmer erection. Once he let go of the pump here, and you'll see it looks very normal. There's no sign of anything external. There's a small scar above his penis there, but otherwise looks like a very normal erection. And then when deflating, again, stabilizes with his left hand, hits the release valve. And as he holds the release valve, and then we'll squeeze the sides of the penis, and it allows that fluid to go back into the reservoir and back to a more natural, flaccid appearance. A big thing, and pretty much every patient I see asks, what's this going to cost? I mean, this sounds like an implant. It sounds like it's going to be expensive, and a lot of guys, are worried because you hear of plastic surgery implants and how a lot of those can be really expensive. Well, this isn't elective like a lot of those plastic surgery things. I mean, guys with erectile dysfunction that need a penile implant have a medical condition, and this is the most effective and the gold standard treatment for it. And because of that, Medicare really has covered it very well. A lot of consumer insurances also cover it. Vast majority of Medicare plans cover it great. There is edcure.com has a great kind of breakdown on some of those insurance coverages that can help you know. And then our office has worked with this a lot and has a lot of knowledge into how to get you or what you can expect afterwards. But I'm happy to say that they really are very well covered and haven't had many patients have issues at all with it. So some of the benefits, there's all the good things about it. Okay. One, we know a very high patient recommendation rate, a very high patient satisfaction rate. And actually there's a similar study which shows similar numbers for partner satisfaction rate. The implant itself has this antibiotic coding, which when we get to the risk of the procedure, that's incredibly important. Um, Vast majority of insurances are covering it. Medicare covers it quite well. It has a very strong coating and durable coating that really allows these to hold up fantastic. It's very common that we'll see patients years and years, decade later, and implants in, it's working, don't even have to worry about that. And it really is the most effective and really the only effective long-term treatment for erectile dysfunction. A big part of it is also just giving you that natural appearance, that natural ability to get yourself an erection anytime you need it. Don't have to go to the pull out a needle or take a pill and wait an hour. It as soon as you pump it up, it's ready. It'll last as long as you need it to, and then you deflate it. It doesn't have any effect in terms of the sensation to the penis or effect on ejaculation. And it adds back that spontaneity that a lot of the treatments for erectile dysfunction unfortunately do harm, and this is really your best bet at getting that back. Everything in life does have risks with it, though. Okay, and one, it is a surgery. Just a little bit kind of more about the surgery. It's an outpatient surgery. Generally takes about an hour. So it's total time there. It's a couple hours with after monitoring, make sure you're feeling okay. It having a procedure in the scrotum, it's a pretty sore area to be operated on. So a couple of days before you're really getting back to what you're doing, and got to be on light duty for a little bit just while you're recovering. We don't want you to get any kind of hematoma or excessive swelling. It's wrapped up that first night and unwrapped it, and then generally it takes a couple weeks till guys are really pumping it up or anything like that. But the big risk for it, and we really push these a lot to make sure guys are really understand it and know what they're getting themselves into. The most important one, or the one that I'm kind of overly crazy about, and you can ask my former patients about it, is that risk of infection. Okay, that risk has gone down dramatically, and actually there's a lot of good studies that if you have a prosthetic urologist that does a lot of them, that risk is very low. That inhibisome, what's on the implant, drops that rate a lot too. So that's in the like 1 to 2% realm. But your body cannot fight an infection that's on that implant. So similar to if you were to have a knee replacement that gets infected, the only treatment for it is a procedure to remove it. Luckily, that's incredibly rare. But in any kind of patient that has any kind of risk factors, that's one of the big things we go over. Okay, so luckily very rare, but possible. There's moving parts within the device, similar to your car, and those could malfunction and could stop working. With these newer pumps, the rate of that malfunction is very, very low. Some studies at 15 years, 85% of them are still in place and functioning. So that rate is quite low. And like I said, it's very common that we'll see it years and years later, and that implant's still working great. More commonly in the older devices, but there is still some risk of erosion or migration or even unintended inflation of the device. Luckily, with some of these newer models, the rate of that has gone down drastically, but still possible. And one of the things I was told by, I think, a implanter that was probably one of the highest volume prosthetic urologists, and he's now retired, he always said, never implant a stranger. And one of the big things that guys need to understand before undergoing this procedure is what those risks are. And a lot of times you'll see me multiple times in clinic, at least twice or so, going over these risks before we do any kind of procedure. Okay, because you really need to know what those risks are and understand them, and make sure that this is a good option for you. If we can give you anything from today, it's that you're not alone. Okay, erectile dysfunction is common. Way more common than anybody realizes. And treat or not just treating the erectile dysfunction, but getting into a physician if you're having erectile dysfunction can a lot of times help uncover other issues that may be going on that can help you in other ways. Not to mention just the benefit from treating the erectile dysfunction and the possible quality of life improvement from having that done. This edcure.com website is a fantastic resource. Boston Scientific, who makes the implant, owns this website, and it has some great resources on it and different information about it. The I might have going back to the patient. The patient, oh, wasn't on there, but they have a whole series about um, guys that have had the implant in and the effectiveness of it and their satisfaction rate after it. And you can hear from guys that they themselves have an implant and how well it works and what they've liked about it. And that's one of the best video series that's on that website. So I highly encourage you to seek that out. And I highly encourage you to talk to your primary care and to get in and see us and see what options we may have for you and how we can help you in treating erectile dysfunction. And here we got a lot of different resources there.